I'm going to give you an overview of what so far has happened in COVID-19. I'll give you the background, the preparations prior to the COVID-19 in Ghana, government's response to COVID-19, driving force for Ghana's success story. I say success story because recently we didn't do it, but we claim we are number 3 in the whole world. And also the driving what next, which is very important. The background, as you are all aware, the WHO first notified us of the outbreak of the novel coronavirus in Wuhan province in January 2020. Following that declaration of the outbreak, the Ministry of Health activated existing public health emergency strategies. At the national level, we activated the National Technical Coordinating Committee. Then we activated also what we call Emergency Operations Center UOC of COVID-19. And at the regional level, the Public Health Emergency Management Committees were all activated, and the rapid response teams in the various regions and districts were activated. As you are aware, COVID-19 in Ghana is largely, or in the world, is largely a health-driven action. It's focused on public education and sensitization of what then was known as 2019 novel coronavirus. Then there was a lot of public engagement on COVID-19 through press release. In fact, the first press release, which was done by the minister, was done on behalf of the government on the 21st of January 2020. There have been, since that time, a lot of media engagement of government's preparedness. We are all preparing to see a case. And unfortunately, we had our first 2 cases, which were all imported on the 12th of March 2020. That's a day after WHO has declared COVID-19 as a pandemic. And since then, we have received a lot of cases, which I will come to the latest cases that we have seen. Preparation for COVID-19 was through leadership. In fact, the leadership of His Excellency the President was to ensure preparedness of the pandemic in Ghana. The President quickly set up a presidential COVID-19 task force, which I'm happy to tell you that he has chaired all the task force meetings, which sometimes were done in the early stages every day of the week. He once told me, "Doctor, now Jubilee House is all about health." I was very happy as the presidential advisor on health, because health became #1 priority in the country, and for that matter, in the world. The whole government, it was a whole government approach, including all the ministries: health, interior, finance, communication, education, national security, trade and industry, defense, information, foreign affairs, agri, and also the Ministry of Sanitation and Technical Innovations were also all part of the COVID-19 task force. Each ministry was assigned specific tasks in the national COVID-19 response efforts, and government appointed a coordinator who was a former Deputy Director General of the WHO to coordinate all the affairs in the ministry. And we have also established a command center where I work together with him and other people to make sure that the response is achieved. The government response was to protect lives and livelihoods. And also, as the President has always been saying, he wants us to turn the crisis into opportunities. The government of Ghana response was driven by 4 key underpinnings. The first one is also approach. And we are all aware, and we all agree with me, that anytime the President moves us around, there is no politics in it. It's not like other countries where when the President talks, it brings problems to the country. It's also all government approach. That's why we have the task force involving all the government ministries. And as he always says, it is driven by data and science. And the last point is that everything that we do is backed by legislation. By the legislation, the government imposed imposition of the Restrictions Act 2020, Act 1012, and also COVID-19 Trust Fund Act 2020, Act 1013. And there have been a series of executive instruments. Executive Instrument 68 of 2020 was passed on the 17th of April. And we also have Executive Instrument 164 on June 15th, 2020. The minister was also asked to go and invoke the Public Health Act 851 of 2012 to grant powers to the Minister for Health in public health emergency situations. And then lastly, these legislation instruments provided a legal basis for restriction of movements, mandatory wearing of masks, among other measures. In fact, if you don't wear a mask, you can be arrested and taken to court and then charged. I think it's 4,000 Ghana cedis or 4 months in prison or both. All government approach, how do you do it? All ministries and their agencies were involved in the response across all levels of governance. Initially, we were having daily meetings, which was always chaired by His Excellency the President. The regions were also charged to have also the regional coordinating directors to have regional meetings, which the regional ministers were providing leadership. The metropolitan, municipal, and district assemblies were also charged, and the DCEs were also providing leadership, working together with the health professionals in the districts. All regions and districts activated their public health emergency management. The National Technical Coordinating Committee, overseeing the implementation of health sector actions and collaborations with non-health sectors, was also activated, and they have been working since. The National Emergency Operations Center was activated, as I said, with 4 thematic areas actively engaged in response, and they meet every 2 weeks. Initially, it was every week. The 4 areas are the surveillance, case management, risk communication, and laboratories. It has been all society approach. You all will agree with me that there have been continuous engagement of all the society. The Ministry of Information have been leading press briefings. It was twice a week on Tuesdays and Thursdays. And the President also have been updating the population and the famous fellow Ghanaians on Sunday evenings. So far, the President has given 19 addresses to the nation about COVID-19. There has also been broad stakeholder engagement of various organizations and groups. And we have intensive public education through the Ministry of Information and its agencies, the Ghana Health Service, and the Ministry of Education, among others. We've always been saying that whatever we are doing through data and science, decisions on response to the pandemic in Ghana have been driven by data and science largely. The team of public health experts, medical laboratory scientists, and expert physicians have been involved in rigorous assessment and review of data for making decisions. We have been engaging with institutions such as School of Public Health, the Ghana Academy of Arts and Sciences, among others, and the professional civil society organizations, and also opinion leaders. Our resilient contact tracing regime ensured that cases were promptly identified and managed earlier to prevent complications, which was science and data-driven. In fact, we did the lockdown, not just to lock down. We locked down to learn about the disease initially. And we got the dynamics of the disease. And as the President said, we cannot lock someone down forever, because he's virtually living in the street. So if you lock the person down, what should the person do? So we locked down for 3 weeks to learn the dynamics of the disease, to learn the science behind it, and then move forward with whatever we do. The reopening of the senior high schools was also done with careful risk assessment and reliance on data-driven effectiveness and control measures. Other key actions, that's the activation of emergency use and authorization window for procurement of medicines, if trial window also done. And there have been a lot of investment in COVID-19 response, and private sector has been involved in all the fight. Following the report of our first 2 cases of COVID-19 on March 12, 2020, there have been several measures, as you are aware. I will mention a few. Of all ground crossings with neighboring countries, Togo, Ivory Coast, Cote d'Ivoire, Burkina Faso, on the 22nd of March 2020. We also suspended international travels. And also agreed with me that when it was announced on the 22nd of March, we, of government, passengers who had mandatory quarantine for 2 weeks, which we tested 105 passengers positive. There are the potential 105 passengers who have infected the 30 million population. We also imposed lockdowns in Greater Accra and Greater Kumasi metropolitan areas and enact legislation to support response efforts on the 30th of March for 3 weeks. Since then, we've seen over the time the dynamics of what cases that we are having. In fact, around July and June 30th to July 4th, that's where if you allow me, I'll say that Ghana peaked. We have the largest number of cases, nearly about 1,000 a day, and since then we came down a bit. We also have a spike, and then we came to the 20s and 25 cases, which slowly we've been going up over the last few days. I'll give you the number of total update at midnight, 21st of November 2020. We have a cumulative cases of 51,181 out of 582,707 tests done, both at Kotoka International Airport and also in our 17 labs. We have 50,029 discharged patients, which means that we have recovery rate of 97.7%. Unfortunately, we've lost 323 cases, which means that the case fatality as at midnight 21st November is 0.66%. And on the 20th of, he gave the figure for 19th. On the 20th, the active cases were 940. So we moved from 1,037 or so, or 17, to 940 on the 20th. And on the 21st, we've moved, active cases have moved to 832. We are slowly coming down again. As we are aware, we came as low. September, October was one of the better months for us. We came as low as less than 400 active cases, up again to about 1,500, and slowly we are coming down again. After the presidential speech on 2 weeks ago, people have started wearing the masks, and I think we have a slight improvement. The total test done, as I said, is 5,707. Unfortunately, the 90 cases that we had between 20th and 21st, 70 of them are from Greater Accra. And in Greater Accra, almost all the districts are involved except Ada East, Ada West, and I think Ningo Pram Pram, which is not involved. So Greater Accra is still having the burden of the disease, about 70 cases. Eastern region has 6 cases. Ashanti, which was second to Greater Accra, now had a few cases, 5. Western region had 2 cases, and unfortunately, we have not been having cases in Northeast, but on the 21st of November, we had 1 case in Northeast, which when I was sitting here, I was calling to find out where the case comes from. We are interested in the areas where there are no cases to find out what is happening there. So we quickly are doing contact tracing to find out what is happening there. It becomes a new fire. So we want to quench all the new fire and fight the big fire in Greater Accra. What we have seen, if you compare what we are seeing to the whole world, between November 2nd to November 16th, the active cases rose from 1.22% to 2.9%, which was very worrying. And we were all aware that we have the second wave in Europe and America. People are coming in for holidays, so we have to prepare ourselves for Christmas. But God being so good, we always take the lead. We are testing at the airport. So far, we have tested over 64,000 passengers at the airport, and we had about 250 positive cases. These are potential people who have gone into the society to infect the rest of the population. We take them out, we manage them, sort them out, and treat them, and make sure that you follow them for 14 days, and then we declare them discharged. The negative cases are also taken care of, and we follow also them up, and they make sure that they also don't get infected. The fact that you are negative today doesn't mean you'll be negative throughout, because even moving out of the airport, you can be positive. That's why people don't understand why we are doing at the airport, even though people come with 72 hours test. So we also know that there's fatigue, which I called corona fatigue. Because of that, the president in his last address encouraged the frontline health workers and the health workers on the whole, and prolong the facilities that we are giving to all health workers to the end of December, and also give the 50% we are giving to the health workers. So what I would say is that we can reverse this trend, and we can reverse this trend by strictly going and adhering to the safety protocols. Proper face masks will protect both of you and your neighbor. And also public increasingly doing social workplace and office place distancing. In fact, the Greater Accra cases, what we have seen, most of them are for public places. It's workplaces where people are getting infected. I can even see in this room there are 2 people who are sitting at the back who are not wearing their mask. Even though we are in an enclosed environment, and the risk is higher in enclosed environment than in open spaces. People are ascribing the increase that we have to the political activities, which I beg to differ. Because the political activities are not only in Greater Accra. Activities are all over the country. So the question is that why are we not having it in all over the country? It's because the political activities are now in open spaces, which the risk is low. People are doing a lot of health work, which is they walk briskly. And what we are telling all the politicians is that anybody who is with you, let the person wear the mask. If they don't have it, provide the mask. Unfortunately or fortunately for us, about 80% of Ghanaians you see on the street have a mask in their pocket. And the time that they have to wear the mask is the time that they are having an encounter with somebody. When they are speaking directly to your neighbor, then they say, "You cannot hear me well," so you pull the mask down. Unfortunately also, most of our workplaces have stopped the hand washing and hand hygiene, including our media houses. They stop even wearing masks where they are broadcasting, and they tell you they put some humidifier there, that there's a humidifier here. Humidifier, please, doesn't kill coronavirus. It's as simple as that. So let us all continue, follow the safety protocols, and by the grace of God, if you do that, we shall reverse the trend. What are the key facets of our success? The key factors of our success, so far as some of us are concerned and we believe in, is leadership. You can have all the scientists, you can have all the top-notch doctors saying everything. If there's no good leadership, you cannot move on. So I'm happy to say that the strong leadership and commitment of His Excellency the President, which he will continue to do, has given us the success story so far. But we are not yet out of the woods. Responsive actions by key actors and government and non-governmental organizations have also assisted us. Investment have also assisted us. We have initial investment of $100 million to support, which was declared by the President, and subsequent commitment in resource enabling and procurement of personal protective equipment and other supplies. Public support for actions of government across all spectra of society has also helped us. And above all, the grace of God. Because we are not different from any other body, any person. But by the grace of God and with the support of the society and good leadership, we are moving on. If you look at it all, the good leadership through using data and science for effective decision-making, contact tracing, case management, and imposition of restriction have assisted us. Or the government approach using the intersectorial collaboration, synergy in utilization of resources, and effective implementation have also helped us. And all the society approach through the cooperation from communities, support for government response, and private sector collaboration have assisted. And the legislation which has enhanced the opportunity for adherence, legal basis for implementation and response have helped us. All these things come together to give us low number of cases, low mortality, and also high recovery rate. And above all, as I said, by the grace of God. What next? What next is the most important that I want to discuss. As you are aware, the battle is not yet over. Yet, despite the few cases being recorded and the low mortality, the easing of restrictions that we have started, now footballers have started playing football. We have asked them to play an empty stadium, but we heard that last Sunday people were standing in houses around the bunch together and watching the football. There's nothing we can do but to appeal to people. So the restrictions by no means is admission of the disappearance of COVID-19 from Ghana. I think that's what people are thinking, that because we've said everybody should go and do whatever they are doing, now the COVID is over. We are learning to live with it, and the march is on, but let me admonish all of you to continue upholding the COVID-19 safety protocols. Elections are coming. Post-elections, I'm happy to say that we've met the Electoral Commission. They put in measures, which they did during the registration. They even put in further measures. This is only one day. So elections, I'm sure, will go through without any problems of COVID. The post-elections is very important, the celebrations. Social distancing will be a thing of the past. but we admonish everybody to put on the mask and use sanitizers. Xmas activities are coming, and the second wave in Europe and Americas is also very worrying. His Excellency the President will continue to demonstrate leadership and strong commitment to fight COVID-19. But we have to prepare ourselves for COVID-19 vaccines, which is very important. That's the reason why we have to help. It's very expensive. So we are preparing ourselves for safe, efficacious, and also affordable and available, and most importantly, acceptable vaccine. If the vaccines are in the country, people don't accept it, you cannot give the vaccines. But before then, our main tranche that we have to use is the safety protocols. We must support him to win. So we must support the president and the government to win this fight. And continuous support of government and actions and responses to the pandemic is very important. We should all remember, I'll end by saying that we should all remember that face masking and protect both yourself and others is very, very important. And social distancing where necessary, where you can, is also very important. And regular hand washing, sanitization, and improvement in our personal hygiene is very important. To tell you a story, since we started washing our hands, this year, diarrhea disease have gone down. And I'm also happy to say that for the past 4 years, we have also diagnosed, only confirmed 3 cholera cases in the country. Because we had a cholera outbreak in 2014, ideally, the cyclical is that you have immunity, and every 4 years, if you don't do anything about it, you also have cholera. But because of good sanitation that were happening, water for the households, and also toilet for everybody, it has brought the cholera down. And more importantly, the regular hand washing, the regular hand sanitization has also improved on our hygiene practices, and diarrhea diseases is down. And we hope that if you continue that, even after COVID-19, cleanliness is godliness. So you should continuously be washing our hands. Now the sanitizers are very cheap. If you continue using it, we will be where we are, and we'll continue to reverse the trend. And I'm happy to say that, luckily, we are reversing the trend. We hope it continues like that till after the elections and also the Christmas time. And if you all continue to do that, and help the COVID Trust Fund to assist us, because going forward, what we need to do is for our scientists to do a lot of research to look at the dynamics of Ghana COVID-19 so that we tell our story. Nobody should tell our story for us. And this you can do by putting in money and donating to COVID-19 Trust Fund. We shall be knocking at the door of the Trust Fund to help scientists to do research into the COVID-19. Thank you, and God bless all of you.
Thank you very much, Dr. Nsiah-Asare.